Hello, this is Dr. Kevin Jones with Flow Wellness, and we're going to go over how to use medication when it arrives in the mail. You'll get a box or package from the pharmacy shipped to your house. When it arrives, it'll come in with an ice pack. If the ice pack is melted, that is totally okay. The medication is stable and at room temperature and even warmer temperatures from 5 to 7 days as long as it's sealed. The medication may arrive in a different size vial depending on the manufacturer. It might be really small, it might be larger. That's totally normal. When the medication arrives, go ahead and put it in the refrigerator. When you're ready to use the medication, take out the packaging and look for the instructions. They could be on a plastic bag that holds the medication. They could be on a bottle, and the instructions could be on the vial itself. The instructions will tell you how much medication to use. When you're ready to use the medication, go ahead and wash your hands and get set up. You'll need an insulin syringe, which will come with the medication, a sharps container that we can ship to you if you don't have one already, an alcohol swab to clean the medication and clean your skin, and the medication itself. So on this medication that I'm going to use, the instruction is to inject 20 units. Now it might say units or milliliters. That's totally fine. That number will correspond to what's on the syringe. This is called an insulin syringe. So to start with the medication, there's this lid on it that oftentimes will have different colors. We're just going to go ahead and take that off. We don't need to put it back on. It seals afterwards. You can just go ahead and discard the lid. After opening the lid, we're going to go ahead and clean the top of the medication. And then we're going to get our insulin syringe ready. So there's two safety caps on this syringe. The top one has the needle. They just pull off. They don't need to twist, just pull them right off. And the bottom one has the plunger. So to get the medication out of the vial, we're first going to start by pulling back the plunger. So I'm pulling down to the number that I want to inject. So in this case, it's 20, so only a little bit. And then I'm going to go ahead and take the medication with my other hand and hold it upside down. And I'm simply just going to insert the needle, just stick it right in, and then push in. And then I'm going to pull back to 20. Now the medication may be clear, it may be red, it depends on the additives that are included. Now when I have it all ready to 20, I'm just going to go ahead and take it upright and pull the needle out. And now I can go ahead and get my skin ready. So I'm going to take the alcohol swab and pick a spot anywhere on the belly, just not in the belly button, just somewhere off the side. Clean the skin. I'm going to hold the needle like a dart, and I'm just going to push it straight into my skin, make sure it's in, push the plunger down, wait a second or two, and take the needle out. This can be scary. It's very minimal pain, if not painless. This is the smallest needle available for use. If you have any questions, feel free to give us a call. It's really not that hard. Just trust us on this one, but we're always here if you need us. After you're done with the needle, just go ahead and put it into the sharps container and put your medication back in the refrigerator, and you're all done until your next dose.